Assalamualaikum warahmatullahi ta'ala wabarakatuh. Greetings of peace, everyone. So, today in this video, we will discuss an important topic in nursing practice, which is the legal and moral aspects of nursing. This topic is essential because nurses are not only responsible for providing care, but also for ensuring that their actions follow legal standards and ethical principles. As future nurses, you must understand that every action you perform in patient care has legal and ethical implications. This means that your decisions should always protect the patient's safety, rights, and dignity. So now let's talk about the legal protections in nursing practice. So the first legal protections in nursing practice for the healthcare providers, such the nurses, we have your Good Samaritan Acts. So Good Samaritan Acts refers to laws that are designed to protect healthcare providers who provide assistance at the scene of an emergency against claims of professional negligence unless it can be shown that there was a gross departure from the normal standards of care or willful wrongdoing on their part. Now, gross negligence usually involves further injury or harm to the person. For example, an automobile may strike an injured child left on the side of the road when the nurse leaves to obtain help. So again, Good Samaritan Act refers to laws that protect healthcare providers who give emergency care at the scene of an accident or emergency from being sued for negligence. So, provided that they acted in good faith and within reasonable standards of care. So, this is simply the laws that protects us in case of rendering services for patients who needs emergent care in an accident or in the community itself. Now, with this act, it gives us a protection against any illegal liabilities, no? So, in simple terms, this law encourages healthcare professionals to help people during emergency without fear of legal consequences, as long, again, we have this decision, condition, as long as they do not act recklessly. They should do the emergency procedure with ease, with deftness, with being careful, and with no implementing any harm or injury to our patient. So imagine, example, just imagine imagine a nurse walking home and witnessing a motorcycle accident. Now the victim is bleeding heavily and the nurse immediately applies pressure to the wound because when there's bleeding, we need to apply pressure. Now to stop the bleeding and call emergency services. If the nurse provided care based on her knowledge and training, the Good Samaritan Act protects her even if the patient later develops complication. For as long as she or he implemented a care or provided a care based on her knowledge and training, then the law protects her. However, the law does not protect the gross negligence. So, what does gross negligence means? Now, sabi natin ay we said that it usually involves further injury or harm to the person. So, suppose that the nurse moves a patient with suspected spinal injury without proper support causing paralysis. If it can be proven that the nurse acted carelessly and ignored the standard procedures, legal protection may not apply. So this is what we call ano to, exempted with the rules of your or the act of Good Samaritan law. So if the nurse had provided care and caused further harm or injury to the patient, then it will not protect the provide healthcare provider. Okay, so that's all for your Good Samaritan Act law or Good Samaritan Act. Now, next protection of healthcare providers or nurses is our Nursing Code of Ethics. So, a code of ethics is a formal statement of the values and ethical principles of a profession or it is the formal statement of a group's ideals and values. So it guides nurses in making moral decisions and maintaining professional behavior. So this is a set of ethical principles that first, it is shared by the members of the group. It reflects their moral judgments over time and serves as a standard for professional actions. Now, nurses are responsible for being familiar with the code that governs their practice. So, the nursing code of ethics serves different purposes. As such, first, to inform the public about the minimum standards of the profession and help them understand professional nursing conduct. So it informs the public about the standards of the nursing practice. So what are the do's and don'ts of the nursing practice? Because we have limitations. Example, we cannot give medications without prescriptions of doctors. Otherwise, if you became a nurse practitioner in the future, then you're allowed, but not on the level of medications that needs prescription by the doctor. Okay. So another is you cannot perform any invasive procedure such as surgery without the doctor because it should be done by surgeon. So these are different standards of nursing practice. Another is it provides a sign of the profession's commitment to the public it serves. So it demonstrates the profession's commitment to patient care. So again, nursing is a caring profession. We are committed in providing care to our clients. Another, it outlines the major ethical considerations of the profession. So it guides the nurses in ethical decision making. So we have to weigh the pros and cons of the things that we do to our patient, not just because it's okay, but you have to think through, no, when making decisions. Okay. Another, it provides ethical standards for professional behavior. So it promotes self-regulation with the profession, because if you know what are the different standards for your behavior, then definitely you can regulate yourself within the professions. So guide the profession in self-regulation and remind nurses of the special responsibility they assume when caring for the sick. So just example lang, a nurse caring for terminally ill patient must treat the patient with respect and compassion. Even when the patient is emotionally distressed or difficult to manage, the nurse action must reflect the values of profession. Or another example, the patient wishes not to be bothered, not to be what do you call this? Not to be given any medications, or he or she refused all the medication treatment. So we have to respect that autonomy of the patient, and then you will let them sign a form that, okay, you refuse this kind of emergency or treatment, then at least it is well documented. Okay, so we have here different ethical principles or moral principles that we apply in nursing. First, we have your autonomy. Autonomy refers to the right to make one's own decision. It refers to the patient's right to make their own decision regarding their healthcare. Now, with what I have given example earlier, so if the patient decided not to be treated anymore, then you have to respect that. Make sure that the patient decided with a sound mind. Now, if the patient has difficulty understanding the situation around her, or he or she is not capable of making that kind of decision, then we have to look for another significant others who can give that decision for her. Example, if the patient is a minor, if the patient is not in sound mind, example, if he or she has a mental illnesses, then we can look for another next of kinship to decide for her or his healthcare. Another is non-maleficence. It is the duty to do no harm. So the nurses must avoid causing harm to patient. For example, before administering medication, the nurse must check the correct drug, correct dose, correct patient, correct route, and correct time, or the 10 rights of medication. So giving the wrong medication could harm the patient. So you have to avoid that one. As much as possible, we apply do no harm. Another moral or ethical principle is your beneficence. Beneficence means doing good. Nurses are obligated to do good, that is, to implement actions that benefit clients and their support person. So again, beneficence meaning doing good and acting in the best interest of the patient. For example, if the patient is experiencing pain or severe pain, the nurse should advocate for appropriate pain management and ensure the patients relieve pain. So we tell the physician that, doc, the patient is in severe pain. Can you give any pain management that is suitable for her? So every now and then, okay, we do good for our patient. So another is your justice. It is frequently referred to as fairness or equal treatment of patient. We do not discriminate our patient. If he or she is poor, if he or she is rich, we have to identify the patient or provide services to the patient based on urgency. Even though it's he or she is a child of president, do not prioritize that one. It is based, the prioritization should based on the needs of the patient. For example, a nurse should provide the same equality or same quality of care to all patients regardless of their social status, religion, or financial condition. So another ethical or moral principles that we use in our practice is your fidelity, which means to be faithful to agreements and promises, or keeping promises and being faithful to our professional commitment. So, when we become nurses, we do our oath. Okay? Oath taking. Now, when we do our oath, it only means that we do respect our standards of nursing practice. And you are committed to do so. So, fidelity is making sure that you are faithful to your profession, you are faithful to your commitments. So example, if a nurse tells a patient that she will return in 10 minutes to check on them, she must follow through with that promise. Anything that we promise to our patient must be done. Okay, ma'am, I will go back, okay? I will just have anything ganito ganito. So, you have to do that. Another is veracity. Meaning, veracity or honesty is the same, okay? It refers to telling the truth. So example, if a medication error occurs, the nurse must report it honestly instead of hiding the mistake, okay? So another is accountability. This means answerable to oneself and others for one's own action. So another important concept is your accountability. You should be able to answer to your own actions. So example, if the nurse administers the wrong medication, the nurse is accountable for that action. And now, anything happens to the patient, you are held accountable for that. Okay? You must report it according to hospital policy. Now, another ethical responsibility or moral principle is responsibility, which refers to specific accountability or liability associated with the performance of duties or particular role. We have learned earlier that we have different roles and function in the healthcare system. Now, that is your responsibility to your patient. You must do what is known to be your role and functions. Okay? So, the specific accountability or liability associated with the performance of duties of a particular role. Okay? So, that is for your ethical principles. Again, this we have here autonomy, non-maleficence, beneficence, justice, fidelity, veracity, accountability, and responsibility. Now let's talk about how to provide competent nursing care. What is competent nursing practice? Now, competent practice is a major legal safeguard for nurses. The nurses must perform care within their scope of practice, education, and job description. So this is the most or major legal safeguards. So if ever, if you will be sued for anything that you have done, if it's documented and if it's within our scope of practice, if it's within our knowledge or education and job description, you are safe. Okay? So this means, okay, based on this competent nursing care, the nurse should or need to provide care that is within legal boundaries of their practice and within the boundaries of agency policies and procedures. So in simpler terms, the nurse should follow hospital policies. Okay? Another, the nurses thereof must be familiar with their various job descriptions that may vary and may differ from agency to agency. So you have to know what is your job description, because per agency it is very different, no, depending on the position that you have. Now if you're a nurse manager, you are different from nurse supervisor. Now if you are a practicing nurse, okay, charge nurse or primary nurse, you have different responsibility also. So you have to be familiar with that. Now, every nurse is responsible for ensuring that his or her education and experience are adequate to meet the responsibilities delineated in the job description. Or, in simpler terms, you have to maintain clinical competence. Because if you are clinically competent based on your education and expertise or experience, then you can perform that and you are safe. Okay? So, okay? So, that, and also lastly is to protect patients from injury. So, overall, this is what we call the competent nursing practice. Now, if you do this one, that means you are doing your practice competently. And now you will be safe from any legalities, okay, if you do this type of nursing practice. Now if you're not doing a competent nursing practice, then you will have difficulties in protecting yourself against any legal matters. Okay, so example, a nursing student should not perform an IV insertion without supervision because it is beyond their training level. So what are the practice guidelines, legal protection for nurses? First, you must function within the scope of your education, job description, and Nurse Practice Act. Another, follow the policies and procedures of the employing agency. Next, build and maintain good rapport with clients. Another is always check the identity of a client to make sure it is the right client. Next, observe and monitor for the client accurately. Always communicate and record significant changes in the client's condition to the primary care provider. Promptly and accurately document all assessments and care given. Another, be alert when implementing nursing interventions and give each task your full attention and skills. Perform procedures correctly and appropriately. Make sure the correct medications are given in the correct dose, by the right route at the scheduled time, and to the right client. When delegating nursing responsibility, especially if you are a nurse manager or nurse supervisor, make sure that the person who is delegated a task understands what to do and that the person has the required knowledge and skills. Another, protect clients from injury and report all incidents involving the clients. Another, always check any orders that a client questions. So example, if there is, because there are times na the doctors may slip any records or medications that redundant or repetitions. We have to reassure that one that there is no repetition or repeated entries of medications, okay? And if the patient questions everything, you have to inform them of, or what do you call this, give them prior knowledge. For that, they will because if they are what do you call this, knowledgeable of the interventions that you will give, then definitely they will not ask further questions. So know your own strengths and weaknesses. Ask for assistance and supervision in situation which you may feel inadequately prepared. So because nurses do not know at everything at all, okay? Especially for example, I don't know any I'm not really expert on doing clinical duties because I'm a nurse educator. So there are limitations of the things that I do in clinics, especially when I go to duties with my students. There are limitations. So if I don't know the specific procedure, then I ask supervision from the nurses also. It's not because I'm a nurse then I'm expected to do it and I'm expected to know it. No. No. So if you don't know, if you're not familiar with a specific procedure, then you have to ask from your from other nurses. So maintain your clinical competence. For students, this demands study and practice before caring for clients. Now, for graduate nurses, it means continued study to maintain update clinical knowledge and skills. So just example, no, myself, I chose nursing education for me to be updated in my clinical knowledge and skills because we have to really accept that when we are in the hospitals, when we are in the communities, there are no other ways to update your knowledge by other ways other than the trainings. So if you don't do trainings, then definitely you cannot update your knowledge and skills. Now, when we do trainings, it's not for free. You have to pay. So definitely it is really hard for clinicians, for community and health nurses to do trainings without money. Okay? Unlike nursing education, um, we can update ourselves with the prior knowledge, and then the application is easy for when you're doing duties with your students. So I think it is really good. The field that I'm doing right now is really good compared to other fields that I have already tried. Okay, so now let's talk about um, carrying out a physician's order. Now we all know that one of the what they call this responsibilities and functions of nurses is to carry out any physician's order. Now, we nurses are expected to analyze and question unclear or unsafe medical errors, even though that they are prescribed by the physician. As the advocate of the patients, we have to question and analyze any procedures or any medications ordered by the physician or primary care provider. But not necessarily that every step of the way you have to ask like this, why is it done like that? No, you have to ask questions or analyze procedures where you are unclear. And I think that is not needed by the patient. So I think it would further cause harm to the patient, and it will not give any the benefit or beneficence. So you can ask that kind of procedures or medical orders that was given by the physician. So it is the nurse's responsibility to seek clarification of ambiguous or seemingly erroneous orders from the prescriber, especially if the another example then is when the physician has a handwriting that is not, impossible to understand. So you really have to seek clarification for that because it's really hard to implement uh what they call this orders without really understanding the main or the writings. That's why electronic health record is very important, and it is very good for us nurses because we don't have to really understand those ambiguous handwritings of doctors because they will only type it, they will encode it, and it's really really easy for the nurses to carry out physician's order if it's more on electronic. So clarification from any other source is unacceptable and regarded as departure from competent nursing practice. So example, nurse Hata or Dr. Noor prescribed the medication. However, you asked Dr. Bato about it. So you seek from another healthcare provider. So that is beyond, or that is unacceptable to our competent nursing practice. So if you have to clarify things, you should be, or you should clarify it with the healthcare provider. So if the order is neither ambiguous or nor apparently erroneous, the nurse is responsible for carrying out. Okay, so there are several categories of orders that nurses must question to protect themselves legally. First, questions any order a client questions. For example, if a client who has been receiving an intramuscular injection tells the nurse that the healthcare provider changed the order from injectable to oral medication, the nurse must recheck the order before giving the medication. Example, the nurse is receiving insulin shots subcutaneously. Now, the other healthcare provider gave the medication through oral. So you have to recheck that one because the patient will now ask, what is that? What is that? Okay, why is it given through oral? The previous healthcare provider gave it to me through injection because that's an insulin. So you have to recheck the order. Another question, any order if the client's condition has changed. The nurse is considered responsible for notifying the primary care provider of any significant changes in the client's condition, whether the primary care provider requests notification or not. So that's why we have nurses' notes. We document any changes from our patient, improvement or not improve or not, or any complications. We have to document that for the doctors to know, and implement or remove any medical managements that were done or that were not really needed by the patient. So, example, if a client who is receiving an intravenous infusion suddenly develops a rapid pulse, chest pain, and a cough, the nurse must notify the primary care provider immediately and question continuance of the ordered rate of infusion. If a client who is receiving a morphine for pain develops severely depressed respiration, the nurse must withhold the medication and notify the primary care provider. So, if there are instances that the patient has allergic reactions or any adverse reactions from the medications, we are allowed to stop the medication. However, if you stop the medication, you have to refer it or notify the physician. So another orders that we can question is question and record verbal orders to avoid miscommunication. So especially if the doctor is made their rounds and then he told you or she told you that, okay, kindly record this one. No, you have to question that one. You have to ask the doctor that, doc, as far as I know, you have to record that one I have to be asked if that is documented. So, in addition to recording the time, the date, the primary care provider's name, and the orders, the nurse documents the circumstances that occasioned the call to the primary care provider, reads the orders back to the primary care provider, and documents that the primary care provider confirmed the orders as the nurse read them back. So, if you were receiving a phone call, example, if the patient or if the physician is not around, he or she attended some meetings, important meetings, so he gave an order through call. So you have to write things down by asking clearly what are the things or orders needed, and then you have to report it back to her. So read them so that the physician will be allowed will confirm it, and then you have to document it that the physician confirmed the order and the time and the date. So another is question any order that is illegible, unclear, or incomplete. Misinterpretation in the name of a drug or in dose, for example, can easily occur with handwritten orders. So you have to clarify. You have to ask talaga yung the doctors, okay? So the nurse is responsible for ensuring that the order is interpreted the way it was intended and that is a safe and appropriate order. So now let's talk about reports or reporting and documentation. Now, communication in healthcare is done through reports and documentation because not time by time we can communicate with our doctors. So, in order for them to understand the case of the patients, we have documentation. So everything that we put in our nurses' notes, everything that we paste or in our write in our nurses' notes, it is read by the physicians. Okay, so reports are oral, written, or audio taped exchanges of information between caregivers. So common reports may include during change in shift report. We have telephone report. We have telephone or verbal order, which is only registered nurses are allowed to accept telephone orders. We have transfer reports and incident report. So these are different or common reports that we can or we always or we sometimes do in the hospital. And then we have here documentation. So when we talk about documentation, it is anything written or printed that is relied on as a record or proof for authorized person, or it is the written records used as legal proof of patient care. Now, proper documentation ensures continuity of care, accurate communication, legal protection. So, principles in documentation may include this must be accurate, okay, comprehensive and flexible enough to retrieve critical data, maintain continuity of care, track client outcomes, and reflects current standards of nursing practice. Effective documentation ensures continuity of care, saves times, and minimizes the risk of error. As members of the healthcare team, nurses need to communicate information about clients accurately and in timely manner. If the care plan is not communicated to all members of healthcare team, care can be fragmented, repetition of tasks occurs, and therapies may be delayed or omitted. That's why it's very important that in changing in shift reports, you have to really endorse to the patient that okay, the labs are done like this, these are carried out by the nurse like that. So there will be no any repetitions of task and the care will not be fragmented. And then we have here data recorded, reported, or communicated to other healthcare professionals are all confidential and must be protected. Um, Making fun of your patients in the nurses station. Okay, everything what your patient have told you, you will report it to the station is not part of being or protecting the confidentiality of the patient. So, now let's talk about confidentiality. Now, confidentiality is again it is the privacy, okay, or respecting one's privacy of an individual. So nurses are legally and ethically obligated to give information about clients confidential. It should be private. What happens with you and the patient should be only from you and your patient. It should not spread from any patients or from any nurses. So nurses may not discuss a client's examination, observation, or conversation or treatment with other clients or staff not involved in the client's care. Only staff directly involved in the specific client's care have a legitimate access to the record. Clients frequently request copies of their medical record and they have the right to read those records. Nurses are responsible for protecting records from all unauthorized readers, especially if the significant others or like that. So if they wish to read those medical records, no, they are not allowed to do so. Otherwise, he or she is authorized by the patient. When nurses and other healthcare professionals have a legitimate reason to use records for data gathering, research, or continuing education, appropriate authorization must be obtained according to agency policies. Now, maintaining confidentiality is an important aspect of profession behavior. It is essential that the nurse safeguard the client's right to privacy by carefully protecting information of a sensitive, private nature. Sharing personal information or gossiping about others violates nursing ethical codes and practice standards. It sends the message that the nurse cannot be trusted and damages the interpersonal relationships. Okay. So now let's go to the quality or characteristics of a good documentation. Okay? So first is a good documentation or a good nursing documentation should be factual. A record must contain descriptive, objective information about what a nurse sees, hears, feels, smells. The use of vague terms such as appears, seems, and apparently is not acceptable because these words suggest that the nurse is stating an opinion. So you're unsure of your documentation. So you have to state facts. So the example of vague terms. The client seems anxious. So if you the phrase seems anxious is a conclusion without supported facts. So the we have you can write it as the client feels anxious about the surgery. So meaning you're assured that the patient feels anxiety. Okay? Next, accurate. Documentation must include exact measurements. It establishes accuracy. Example, intake of 350 milliliter of water is more accurate than the client drank an adequate amount of fluid. So documentation of concise data is clear and easy to understand. It is essential to avoid the use of unnecessary words or irrelevant details. Example lang natin, no abnormal findings noted. So, what specific normal findings have you seen? So you have to be specific. You have to be accurate. Okay, example, monitoring or regulating the IV of the patient. Okay, regulated the IV at prescribed rate. What prescribed rate is that? 30 drops per minute, 20 drops per minute, 50 drops per hour. Okay, so you have to really document accurately. Another characteristic of good documentation, the documentation should be complete. The information within a recorded entry or a report needs to be complete, containing appropriate and essential information. Example, the nurses or the client verbalizes sharp throbbing pain localized along the lateral side of right ankle, beginning approximately 15 minutes ago after twisting his foot on the stair. The client rates pain as 8 on a scale of 0 to 10. So the data is correct or the data is complete. You have identified where is the pain, the characteristic of pain, the duration or the time of the pain, and the scale of the pain. So with that, you have completed the documentation for your pain assessment. So next characteristic, it should be current. Timely entries are essential in the client's ongoing care. To increase accuracy and decrease unnecessary duplication, many healthcare agencies use records kept near the client's bedside, which facilitate immediate documentation of information as it is collected from a client. So, Everything that you have done should be immediately ano to? Immediately recorded. Do not wait until the end because you may forget it. Okay? So another is organized. The nurse communicates information in a logical order. For example, an organized notes describes the client's pain, nurse's assessment, the interventions, and client's response. So we have different types of documentation that we can use. We have the SOAP, or the SOAPI, or the FDAR. SOAPI, or SOAPI, E, or SOAP stands for S, subjective cues or subjective data. O stands for objective data. A stands for analysis or action. Analysis. And then P stands for planning. Okay? I stands for interventions and E stands for evaluation. So another is your FDAR, focused, data, action, and response. So in that organized in an organized manner, you have to document the findings or any findings you have seen from the patient. So let us talk about the legal guidelines in reporting. So, yung kanina or yung the previous one is about documentation, okay? This one is about reporting. Draw a single line through error, write word error above it and sign your name or initials, then record note correctly. Do not write retaliatory or critical comments about the client care by the other healthcare professions. Enter only objective descriptions of client's behavior. Client's comments should be quoted. Correct all errors promptly. Errors in recording can lead to errors in the treatment. Avoid rushing to complete charting. Be sure information is accurate. Do not leave blank spaces in nurse's notes. Chart consecutively, line by line. If space is left, draw a line horizontally through it and sign your name at the end so that it will not be inserted or other nurses will not insert any interventions that you have not done. Record all entries legibly in a black ink. I think it should be black ink, okay? Black. Never use pencil, felt pen, black ink, not blank ink ha. It's black ink. Ink is more legible when records are photocopied or transferred to microfilm. So we do not write nurses notes in blue ball pen or red ball pen. It should be in black ball pen. If order is questioned, the record that clarification was sought. If you perform orders known to be incorrect, you are just liable for prosecution as the physician is. Chart only for yourself. Never ever chart for someone else. Example, okay, your best friend, okay, your duty mate asked you to sign like an order that you gave. So no, because if the time comes and that nurse will be sued legally, then you will be an accomplice. Once logged in, you are accountable for information you enter into the chart. Avoid using generalized and empty phrases such as status unchanged and had a good day, or the patient was happy, or the patient was satisfied. Okay, so that is very general. Next, begin each entry with time and end it with your signature and title. Do not wait until the end of the shift to record important changes that occurred several hours earlier. Be sure to sign each entry. And for computer documentation, keep your passwords to yourself. Maintain security and confidentiality. Once logged in to the computer, do not leave it unattended. Okay, so that ends my discussion for Unit for the legal and moral aspects of nursing. So if you have clarifications, questions, do not hesitate to ask questions or email me for I can answer your questions. So thank you and have a nice day.